Welcome to the Ear Healing Clinic, where we treat a wide variety of ailments and maladies using the innate healing power of your ears. Now, were there any particular concerns that you wanted to address today? Any health issues at all? I see. Well, if you wouldn't mind, I'd like to take a look at your ears and see if we can match up what's going on with what your ears are telling us. Alright? Okay. Do you mind if I touch your ears? I might be lightly pinching them. I might be pressing into the cartilage at certain points, stretching them, that sort of thing. Okay, excellent. So, let me see here. I am going to start just one ear at a time. And I want you to let me know. I want you to let me know if you feel any pain or discomfort at all. So I'm just going around and very lightly touching the ears. Let's see, right in front of the ear. And while I am going off of where you tell me is painful or tender, I can tell a little bit if there is a textural difference. The tissue feels a bit different. There are a few things I can look out for. Spots, for example, blemishes, all corresponding to a specific area. It's coming along the antehelix, right here in the triangular fossa. Anything so far? Okay. Just supporting the ear as I'm getting into that loop of the helix. This is a bit tricky right here. And the concha, the bowl of the ear. Trachea. Okay, how was that? Alright, let's take a peek at the other ear, and then we'll do a bit of bilateral work. So, right in here along the lobe, gently touching, very gently. And the pre-auricular area. Just using one finger. Rolling my finger around the pad of my finger, rolling the pad. Okay. Get into helix there, antehelix. How are we feeling so far? Trachea. Inside the helix there, leading into the concha. I am going to feel behind the ears. Let me know if this is painful at all. And right in behind here. Okay, I'm just going to stretch them forward. Good. I'm going to stretch them back. Okay. Now I'm going to pull up. Good. I'm going to pull down on the lobes. Okay. Let me get a little bit of a go around bilaterally. See if there's any asymmetry. Along the antitragus here. Tragus. The concha. Okay. Well, I think that we'll grab our little manual tools here, and I'm going to press a couple of places. Let me know how this feels. Right here. And right here. Here. Right at the top of the helix, the ear apex. Here. Here. Oh, right here. Okay. Here. Here. Other side. Here. Okay. Good. There. Right. Right here. Good. Let's see. Look at the ear apex here. I'm just going to support the cartilage. Right here. Right in here. And how about here? Let me just right here. So I have a couple of small little ear guides here, and they just map out all of these different little points which you don't need to know anything special about them, but instead we are going to take a look at the more pertinent spots to treat different issues. Now, I also wanted to offer, if you would be amenable, I would like to offer something that we've been doing complimentary for all of our clinic patients, where we do a little vagus nerve massage. Now, the vagus nerve is one of your cranial nerves, and it has the same root as the word vagrant, because it means wanderer. It's a very long nerve. It gets into a lot of different processes. So by stimulating the vagus nerve, its big function is in dealing with the parasympathetic nervous system. So if you're very stressed, dealing with insomnia, things like that, sensory issues, then we can maybe dial that down a few notches by stimulating that vagus nerve. It seems to be like a nice little tune-up for just about everybody. So I can show you the couple of points we can stimulate. That way you also know how to do it at home if you wish to continue those benefits. Okay? Alright, let's go ahead and bring out our charts. We have a few different diagrams here. We saw our tiny little charts written in Chinese that has the little Auriculotherapy tools listed on the back. But what's going to be more relevant are these charts right here. So, let me just grab a little pointer here. On this one, we have a guide to common maladies that someone would want to treat with our acupressure, auriculotherapy, ear seeds approach. So we have things like fatigue, insomnia, migraines, headaches, myopia, diabetes, shoulder pain, that sort of thing. But for your particular situation, we're going to stay on this side. So what I'd like to do with you is, I think certainly we want to go with a fatigue, insomnia approach, and then maybe add in our headache points as well. So if we look at our ear chart here, we look at all these little points like Shenmen, kidney point, adrenals, forehead, temple, occiput, the heart, the endocrine, the brain point right here, spleen, liver, gallbladder, stomach. I think that I would just add one more, which is going to be the ear apex at the very top. And as far as ear seeds go, we're going to pick about 4 to 5 of these points. Now, I tend to go with a few defaults. So, doing the brain point and Shenmen are a good way to go. Especially for stress, I like to do the spleen point. And I think with all of these here, we could either go maybe endocrine, adrenal gland. I could make a case for maybe the liver even. We'll just kind of see. Where it goes. So the vagus nerve massage that we were talking about, what we would be doing is we would be massaging behind the ear here, so you can't see it on our little diagram, but we would go behind the ear. We would also get right in here by the triangular fossa, the inside of the helix here, right in here. And we would also get right by the tragus and the external auditory meatus, the ear canal, right in here. So we could get right in these areas to stimulate the vagus nerve. So when we do our acupressure, we'll do a little bit of everything, just give an all-over massage. And then we'll go through these different points and target specific areas. We'll get shenmen, we'll get the ear apex, the kidney point, the adrenal gland, all of these different little guys right in here. Do you have any questions before we start? Okay, let's go ahead and put these away. And we'll get started with your treatment. We can start with the vagus massage, and as we talked about before, I'll just be working behind the ear, right here, right in here. We will work inside the helix, right about here, as well as the concha, right in here. Okay? Alright, so let's start behind the ears. Right in here. Now, you might notice that your breathing starts to change. You might notice that your heart rate starts to slow down. Our parasympathetic nervous system also deals with blood pressure, for example, though you're probably not going to feel that one as much. I'm just working behind the ear here, very gentle. We don't want to overstimulate, but instead just very gently soothe. A soothing stimulation, rather. Soothing stimulation. How is that feeling? Good. Now let's get into the helix. I'm going to do this one ear at a time because I'm going to support the ear. So I'm going to put my finger behind the ear so that I'm not pressing it against your head. I'm going to support it and then use my finger here to just very gently work in on this point. Is this pressure okay? Okay. So, this is a very nice little quick, easy way to calm down a bit, help de-stress. If you find you're trying to relax but not really able to, then this override that system, if you will. Just working in the ear. And then the other side, so supporting the ear from the back, working right in here. Now, in doing this yourself, you have a better gauge about what pressure feels okay and what doesn't. So I do this because I don't want to hurt you at all, since I can't tell what you're feeling. I only have what you tell me. So you don't need to necessarily support the ear. You just more go with what you're feeling. If it's too much, you know to back off. If it's too little, you know to apply more pressure. Okay. Now, we're going to go right in by the external auditory meatus. And again, I'm going to support the ear. And then we'll come in right here. And I'm just going to rub into this spot. There we go. And just these very gentle little stationary circles. Nothing fancy. Just rolling my finger back and forth. The other side, supporting the ear. And rolling my finger in the contrary. So you're going to want to make sure, if you do this, that you're mindful of fingernails. That's why I keep mine short for working at the clinic, but you could have them longer if you're doing them on yourself, because you'll be able to feel when you're poking yourself or not. Very good. So, let me just grab our chart here. So, we have a few points that we want to stimulate here. So, I am going to firstly use my fingers, and then we'll use the tool, the acupressure tool. We're going to kind of combine these different points. Let's go ahead. I always like to do our ear apex point. And as I do this, you might feel a little kind of zingy sensation. Or it might feel a little numb. On the other side, ear apex. Good. Now we'll do an all-over massage. And then finish with those specific points with that bit of special attention. And just let me know if at any point we need to do more pressure, less pressure. I tend to err on the side of less pressure just because you can always add more, but too much pressure from the get-go does not feel nice. And that kind of feeling can stick with you for a minute or two as well. Just light strokes here, little pinches, tiny bit of ear stretching around the tragus and the preauricular area, especially for headaches. This is quite nice. Quite nice. And we'll just get very gently all around the ear here. Very gently. We'll just focus primarily on the massage. There's nothing in particular you have to think about. There's nothing you need to do. Just enjoy the massage. Around the helix. And inside the helix. The triangular fossa. Down along the ridge from the antihelix to the antitragus. And inside the helix, the contra here. Gently, gently, gently. Gently, gently, gently. Okay. We hit our ear apex. Now we want to also get the brain point right here. Right here. We want Shenmen right in here. And the kidney point just below that. The brain point. Shenmen. Kidney. The adrenal gland, so we're going to go right in here. And then a little bit farther back, we'll get the heart. Triangulate down for endocrine. going to do the forehead, temple, and occiput points right in a row. Good. And then we will do gallbladder, liver, and spleen. Let's start with the spleen right in here. Spleen, liver, gallbladder, and finish with the stomach right here. Liver, spleen, gallbladder, stomach. Okay. Let's go ahead and get our little spring-loaded tool here, and we'll stimulate those. Then we'll do our little ear seeds. So we want to do the brain point. We want to do Shenmen. Ear apex. We want to do the adrenals. The heart. Endocrine. Forehead. Occiput. Temple. I want to do the spleen, liver, gallbladder, kidney, and stomach. Just supporting the ear here. Brain point. Shenmen. Ear apex. Adrenal. Heart. Endocrine. Forehead. Occiput. Temple. Spleen. Liver. Gallbladder. Kidney. Stomach. And this is going to clean up any of the oils from my fingers so that we can securely fit the ear seats. We're just going to scrub everything down with the cotton bud. And we'll pick some of the most important spots and apply the ear seeds. I'm just going to go behind the ear as well. We did work there quite a bit. Very gentle. Scrubbing everything down. And I'm going to use the dry side to clean everything up. Back of the ear. Front. Good. And we'll do that on the other side. Back of the ear. Nice and refreshing. Front of the ear. Hear the train in the background. Just passing through. Front of the ear. And behind. And then dry it off. Outside the ear. Good. My ears need to dry. And my little tweezers. We're applying the seeds, and then we just need to grab our seeds. seeds backed by a bandage, essentially. So we can take these, and they can be a little tricky here. So I'm just going to grab our little bandage here, and we're going to press that on Shenmen, on each side. Good. And then we'll do our brain point. Right there. The adrenals. And lastly, the spleen. Right here. Now I just want to check that those are secure, so I'm just going to press gently on them. Good. Brain point, adrenal, and the spleen. Shenmen. The brain point, the adrenals, and the spleen. I'm just going to stimulate those areas here. Now with ear seeds, you are going to stimulate these throughout the day whenever you remember. You can take a shower, you can take a bath, you can go swimming, you can do all your normal activities, and they will naturally fall off on their own. Don't need to do anything special except occasionally stimulate them. There we are. So, how does that feel? Unobtrusive enough. Okay. Excellent. So, that is going to conclude your appointment here at the Ear Healing Clinic. Do you have any questions before you go? Okay, well, I'd like to thank you so much for coming in today. I hope that you see the results you're looking for with these ear seeds and with the vagus massage, with the acupressure massage, the auriculotherapy. I hope you have a whale of a day and a good rest of your night. Thank you so much for watching. I really appreciate it. And a big thank you to my patrons on Patreon, without which I wouldn't be able to make these videos. If you'd like to help support the channel and gain access to perks like ad-free viewing of all my videos and audio downloads of all my videos, early access, as well as Patreon exclusive videos, there is a link in the description to my Patreon. Thank you so much.